All right, well, my clock says 10 o'clock and we want to start on time and end on time. So I am going to go ahead and get started. Good morning to everybody. Thank you again for joining us. For those of you that I don't know, I'm Shana Hazan with the San Diego Seniors Community Foundation. Again, great to see so many of our supporters and partners joining us this morning. Today's briefing is designed to offer a firsthand look from local healthcare and community-based service providers into the toll the pandemic is taking on the health and wellness of local seniors, how some seniors are thriving despite these trying times, and how all of us at the San Diego Seniors Community Foundation are working with partners across the county to reduce social isolation thanks to generous support from so many of you. Over the next hour, you'll hear from Bob Kelly, Dr. Ted Chan, and 3 senior center leaders who each serve distinct communities of seniors across our county. Following their remarks, we'll open it up to questions from you for the last 10 to 15 minutes of our program. Before we begin, I do want to give everybody a chance if you want to wave hello or unmute and say hi for just a second before I ask you to mute yourselves again. Great to see all of you.
Good morning, everyone.
Good morning. Good morning. Nice to hear voices. So I will ask that everyone please go ahead and mute yourselves for the duration, at least of our panel. And then if you'd like to share questions during our Q&A, you can, of course, unmute yourself. I mentioned earlier that if you have questions, you can share them by clicking on the chat at the bottom of your screen, and we will save those to the end of the program. Now it's my pleasure to introduce the President and CEO of the San Diego Seniors Community Foundation, Bob Kelly, to kick things off. Prior to launching the San Diego Seniors Community Foundation, Bob served as president and CEO of the San Diego Foundation, where he oversaw all activities, programs, and asset management during a time of significant growth and achievements that have benefited the entire San Diego region. Prior to joining the San Diego Foundation, he served in leadership roles at the American Cancer Society and Sharp Healthcare. Bob currently chairs the Brago Valley Endowment Fund and serves on the boards of the Mingay International Museum, San Diego Hunger Coalition, Legler Benbow Foundation, Voice of San Diego, and Rotary International. So Bob has a lot of free time. He's not busy doing much these days. Bob, take it away.
Okay, well, thanks a lot, Shana. And welcome, everybody. And it's great to see some faces I haven't seen in a while. Hi. We have about 60 people, I guess, that are going to join us today. So that's really, really great. We also have some board members on, and you know, they can wave. I see a few of them. So, and I want to thank the people who have supported us in this whole new venture at the Seniors Foundation. Let me give you a real quick overview of how we got where we are. When I was at Sharp Healthcare, I got assigned to start working with the senior healthcare program at Sharp. And I met a number of dedicated physicians and nurses and people working on dealing with the new wave of the growth of seniors. And it was a wonderful experience learning all about how to take care of seniors. And in fact, I went through senior sensitivity training. And they showed me what it's like when you're a senior, how difficult it is to open up a car, a jar. Hearing goes away, the driving ability to get to appointments is a problem. And the whole process has really made me much more sensitive to what was going on with seniors. So when I left there, went over to the San Diego Foundation, we were fortunate to start working with the Del Mar Healthcare Foundation, and they set up a fund that was focused on seniors. So we started really getting into a little more about the coming wave of seniors. And when I left the San Diego Foundation, you only can play golf so much, you only can go fishing so much. And I said, so what else am I going to do? And so what I saw throughout the United States was really a lack of focus on helping the coming tsunami of seniors dealing with it. And just to give you an example, in San Diego, we have now about 750,000 seniors over the age of 65 and about 150,000 senior orphans. By the year 2030, they're looking at 1 million to 1.2 million with about 250,000 senior orphans. And senior orphans are the people who have nobody in their lives. They were never married, never had any, are married, had kids, married maybe, and their spouse passed away, and they're all alone. And so that wave is coming down the pike. The infrastructure that's there to deal with that is limited. There's some wonderful organizations that are on the call today, and they know what a struggle it is to try to raise money and to be able to provide services to meet that significant increase in the demand. Right now, about 3% of charitable dollars goes to help seniors. And out of about 150,000 private foundations in the United States, there's only about 8 or 9 that have any interest, any focus on helping seniors. So part of what the San Diego Seniors Community Foundation was formed, we were formed to be able to start increasing the awareness of the issue of this huge tsunami of, the silver tsunami, they call it, that's going to hit San Diego. We want to increase the charitable dollars that then become available to all the different not-for-profits in San Diego that can be able to, can provide the services necessary. The Gary Mary West Foundation has been one of the biggest providers of support to the San Diego Seniors Community Foundation. And we're off and running, and we're doing pretty well. It's a struggle in terms of introducing this new issue to the community of philanthropists, but we're doing pretty well. And we're very fortunate right now to have the Somali Family Foundation commit $500,000 for us to go out and match that, to be able to create a pool of funds of about $1 million that we can grant to the different not-for-profits in San Diego that are dealing and helping. In this case, this initiative is isolated seniors. We've raised about almost $220,000 so far of that match, and we've granted out, and we have 3 agencies here today that'll talk about some of the programs that they're doing. So we've granted out the first round of about $200,000 to these agencies, and we've done another holiday round of about $30,000 to 12 different agencies of small grants, anywhere from $1,000 to $2,000, that are helping the agencies help the seniors, especially the isolated seniors, get through the holidays. And you're going to hear a little more about that in a minute. But we're excited about what's going on. We think there's a tremendous opportunity to have a healthy and engaged senior community in San Diego. You've got, again, the vulnerable seniors that we have to deal with, but we also have the whole group of seniors that are healthy, should be engaged in our community, volunteering, donating, doing everything to make San Diego a really, really healthy community. So we're going to talk more about all of that, but that's kind of the intro. Now I'd like to introduce Dr. Ted Chan. And so when I talk about starting the San Diego Seniors Community Foundation, of course, I went out to some of the people I worked with, the San Diego Foundation. Ted Chan was one of the first ones. He was a member of the board of the San Diego Foundation, but he was also the chair of the very first disaster foundation in the United States here in San Diego. We set that up as part of the San Diego Foundation, and we dealt with the fires. And so I got to work with Ted on all of that. And so I said, who can I ask to help get this thing going? And so Ted said yes. Ted is a professor at UCSD. He's the chair of the emergency medicine department here in San Diego at UCSD. He's been on the front lines since March. He has a tremendous perspective, and Ted has actually gotten his vaccine the other day. So he's one of the first ones here in San Diego, because again, he's on the front lines and dealing with the COVID experience. So we'll let Ted tell you a little more about what's going on. Thanks, Ted.
Thank you, Bob. And I want to thank you and your tremendous staff for all the work they've done. And I'm pleased to speak on behalf of my fellow board members who are on this call as well. As Bob mentioned, I run the emergency department at UCSD, and I practice emergency medicine for over 25 years now, a long time. And I will say, even before this pandemic, there was a really dramatic shift happening in emergency medicine and in healthcare in general, which is addressing the needs of this the senior population, whom hopefully we'll all be joining if we're not there already, and the needs, and not only healthcare needs, but the social needs and those social determinants that drive the well-being of this community and these folks. So I will say that on a personal level, my mom is 92 years old, and I help manage her healthcare. She's up in the Bay Area. Fortunately, she has I have lots of brothers and sisters who are up there that help take care of her, but I can only imagine how challenging it is for some of our senior orphans and our seniors in general, in terms of navigating the healthcare system and our social support system and all of that. So as part of that, in terms of my professional career, as I've seen this change, as Bob mentioned, we've worked with the West Health in actually creating the first level 1 geriatric emergency department in the country that really tries to address these needs. And these problems are being seen at Scripps and Sharp and Kaiser, and they've all joined us in this effort on a county-wide level. So all the hospitals, while competitive, are actually working together because we see this as a tremendous challenge ahead of us, moving not just now, but over the next few years and the decades to come. COVID, obviously, over this last 9 to 10 months has really exacerbated the situation, right? Because of the social distancing and the social isolation that has come forth. You know, social isolation and loneliness was a problem for this population even before COVID. Vivek Murthy, who's our once and future US Surgeon General, has really labeled loneliness a global pandemic. And the impact of social isolation and loneliness impacts not only your physical health, that is, there are higher rates of heart disease in seniors who are have higher rates of loneliness and less social contact, but it also drives up rates of anxiety, stress, and depression. And there are studies that have shown that it makes dementia or cognitive issues even more challenging for seniors when they're socially isolated. And we're seeing that with this surge. I'm seeing it in emergency department. Just in the last 3 weeks, I was looking at the numbers. We've doubled the number of COVID seniors that we're seeing in our emergency department. Now, I will say that sometimes I see seniors in our emergency department who are thriving and doing well. I just saw a 94-year-old who I had to diagnose with COVID, and I said, I think you should come into the hospital and stay a couple of days. She said, I'm going home. I live fine. I'm fine. And you know what? I said, okay, let's have our geriatric specialist at least see you and arrange some social support for you at home. But if you want to go home, that I'm happy to get you home. On the other hand, we're seeing seniors who come in who've delayed care because they've been afraid to come into the healthcare setting. So they come in and they haven't been able to get a nutritious meal. They haven't been able to make contact with family or have family to have social contacts with. And they come in with high rates of anxiety, which affects their mental well-being. And they come in with acute medical problems like hyponatremia, hypokalemia, because they have not been eating well or been able to get access to good meals and food on a regular basis, and face a lot of challenges there. So we're seeing all of that in the emergency department. And as I said, our numbers have really remarkably increased over the last 9 months, and in particular during this month and during this surge. And unfortunately, this surge is going to carry out through January, if not longer. So my colleagues and I were just talking about this yesterday on a call in terms of the challenges that our emergency departments across the country are facing as this population, which is at high risk and vulnerable to this pandemic more so than any other populations, is facing real challenges here. So all the efforts of the of our service providers here on this call have been greatly appreciated. They're making an impact, and we see it in our senior population. So with that, I'm going to turn it back over to you, Bob.
Ted, anything about the vaccine rollout that?
Yeah, I think the one glimmer of hope in all of this is the vaccine. It's been rolled out at UCSD, at Sharp, at Scripps, at Palomar. The first wave was designed for healthcare workers, but the CDC panel, as you know, recommended last night that in the second wave would not only be essential workers, but seniors over the age of 65. So that's really exciting. Now, I think the challenge is the logistics of getting that vaccine to this vulnerable population wherever they are, whether they're at assisted living or nursing homes or living alone, living on their own as senior orphans, as you mentioned. I think that's going to be a real challenge. And then also convincing folks to get the vaccine, that is particularly in underserved and in particular our minority communities where the pandemic has been horrible in those communities. And how are we going to be able to convince enough of those folks to get the vaccine, and then arranging the logistics? Because people, particularly seniors, are fearful to coming into healthcare settings right now because they fear the virus so much that they may not want to come in to get the vaccine. So how do we get the vaccine to them? These are all challenges that we can work together as a community to solve, and our senior centers and many of the service providers on this call could play a very, very important role in getting the vaccine out to our most vulnerable community members.
And that's a good point. And I know because I talked to a number of the agencies, they're willing and able, and they're just waiting to see what kind of role they can play to make sure that all the seniors get their original shot and get their second shot.
That's right.
In a safe, environment. Because you're right, they're afraid to go out. And that's one of the big issues that we're all dealing with is isolated seniors. And so thanks, Ted, and good luck on the front lines. Thanks for everything you do. It's a big deal. So I mentioned earlier that we've granted out about $200,000 to 9 different agencies to be able to deal with addressing the issue of social or isolated seniors. And we also just, and again, I mentioned we just granted out another $30,000 to 11 agencies to do all sorts of different programs and projects, just buying mini poinsettias and delivering them. One organization is going to decorate the doors of seniors. So if they feel like it's Christmas and the holiday spirit, they won't have to go in the house. They do it outside. We're also doing a program with the Sheriff's Department. They have a program that it's called No Seniors Alone. You're Not Alone. And they contact on an ongoing basis. They check in with about 200 and 250 seniors. So they've been doing this every year. They've been getting contributions from different organizations, different for-profit businesses to put together a gift basket. But this year, most of those businesses couldn't donate because they've been closed and they had they haven't been able to sell their products out there. So they haven't made any money, so they couldn't contribute. So we made a small grant to the Sheriff's Department, and they're going to take that money and buy some of these products, these toothbrushes and toothpaste and all of the things that seniors might need, and provide that. And they're going to buy it from the places that used to contribute as kind of a payback this year. And then they're going to be able to provide that service to 200 and some odd seniors. So nice small little program that was made possible by some contributions. So now I want to introduce a couple of the 3 agencies today that can talk about some of the programs that they're doing. The first one is Mona Minton from the Neighborhood House Center. She's the general manager of programs and clinics in the Neighborhood House Association in San Diego. Extensive background working with children, adolescents, adults, and older Americans. She speaks and understands multiple languages, currently serves over 6 committees, lending her expertise to address a variety of socioeconomic, gender, and cultural issues. So you want to tell us about what you guys are doing with the grant that we provided?
Hi, Bob. Good morning, everyone. Thank you for giving us the opportunity to, share about what's happening with our participants through our few senior programs. But once again, before I start, thank you again for giving Neighborhood House Association the opportunity to receive the grant for the No Senior Alone initiative. So what our goal is we're looking to purchase multiple tablets. Our first batch of order was placed a few weeks ago, and we're looking to get 40 tablets and internet access for our seniors for about 6 months, starting January. And the goal is that we want to have these seniors who have always participated in hands-on physical activities at our senior center, which are no longer available, and it's been 9 months, as we all know, experiencing the pandemic. And so we want to do art class, bingo, social interaction, wellness checks through the tablets. What we noticed is an average about 30 to 35 seniors we get in contact with on a daily basis to do check-ins. And then throughout the month, we have contact with between 70 to 80 seniors where we do more so whether it's with the family or the senior themselves. And about 50 plus seniors had expressed that they either have flip phones or no phones other than a home line, and they either live by themselves or with a friend or a family who is also a senior. And so they don't have much Zoom connection with family members, medical practitioners, even other resources and events that county hosts where seniors can log in. We actually have 2 seniors that are very committed to attend the Board of Supervisors meeting every single Tuesday. So what he would do is he would do it from our center on Tuesdays, but now because the center is closed, he's interested in having a device where he can log in and watch what's happening in the San Diego community. So the idea is that these folks would participate in activities for our senior center as well as other events that they want to participate, such as logging in to see their family members that reside in different states or even, San Diego cities. And they're very excited. We are very excited. We had a little delay in back order issues, so we haven't received our tablets. We're hoping first week of January we will and start issuing them out. And then the second batch we'll try to issue sometime in February or March. I do want to express that even outside of getting the funding for virtual services, we are facing 2 huge challenges, and that is social isolation and loneliness. Even if we have them participate via Zoom, they are still feeling the loneliness because they still want that direct contact, the touch, that hug that a senior would give. We hugged our seniors. When they walk in, they would come give us a hug, we give them a hug, and they're missing that. And that has, which Dr. Ted said very well, it is causing mental health deterioration such as depression, anxiety. So that is something that we are facing. We have 3 seniors that are in their 90s. One of our seniors turns 100 in March. She has been with us for over 27 years, and we are very proud to serve her and that she's still committed. She's one of our clients who's going to receive a tablet, so we're very excited. And a brief little testimonial that I want to share. Last week, I had connected with a senior through one of our senior programs who has mental health issues, and her daughter installed Alexa for her. And so when I went to her house, we were sitting outside. I was outside her house, and she says, "Dr. Minton, I got to show you something that Alexa can do." And I said, "Okay." And she asked Alexa to play farting sounds. No joke. It was unbelievable, where I had to sit there and listen to all these different sounds of farting, and she could not stop laughing, and I was just blushed red. Like, oh my God, this is embarrassing. But she is having such a wonderful time with Alexa, and she expressed how it has put a smile on her face. She's laughing. She talks to Alexa now, as if Alexa is her friend. And so that is just a fun story to share, that nowadays electronic devices does put a smile on our seniors. And this is the same person who refused to use a phone with smartphone app or even, tablets. So great to see that she is associating herself with Alexa, and she wants to have me hear burping sounds next week when I go visit her. So I'm excited. I've never heard either one. So this is going to be a new experience for me as well as for her. So again, thank you, Bob. Thank you, Dr. Ted. Thank you, San Diego Senior Community Foundation, for giving NHA this opportunity for sharing our story with you guys.
Yeah, Well, thank you for all the work you do, and that day-to-day contact with the seniors is so critical. And the pads, the tablets are really important now, and getting them out to the seniors is huge. And you talk about a story. I just got now I get phone calls because we're the Seniors Community Foundation. People call us looking for help, and we don't provide any direct services, so we send them out to the different agencies. But I got a call yesterday from a guy that 82 years old. His wife is 87. They live by themselves, and they just had a rent increase, and they had to make a decision to either to pay their rent or cut something, and they cut their cable TV. And he says, so now we have no way of connecting to the outside world, and we just sit and just look at each other all day long. Can you help? I mean, those are the kind of stories that are out there. And so with this money that we've been able to raise, it's been fabulous to be able to provide programs, the support for the programs like yours. So the next we have Lisa Noakes from the Peninsula Shepherd Center, and they service the areas of Midway, Ocean Beach, and Point Loma. And Lisa is going to tell us about what they're doing.
Great, thank you, Bob. I'm Lisa Noakes, and I'm the Executive Director of the Peninsula Shepherd Center. I am honored to be here to tell you about our senior community, the experiences that we're having, as well as the challenges. We are very grateful to the San Diego Senior Community Foundation for their grant as well. And we used it in a couple of ways. As Mona mentioned, we have a tablet program, which I'll tell you about. We launched a porch visit program. And also we have money now as when we end up going back into our facilities to safeguard the health and the safety of our folks. So we are very, very happy and grateful for this grant. The Shepherd Center began as part of Shepherd Centers of America. We're all independently run organizations, but we do have that affiliation. As Bob said, we've been in Point Loma since 1983 and have a wide, area in the Peninsula communities that we service. Our mission is really to help keep our folks independent, active, social, and to really make them feel a part of the community and independent. So we do this by providing transportation services. And ours is a door-through-door service, which is important to get them actually inside the home and be safe. And these transportation services are for all the things you would think of, groceries, errands, medical appointments. We also have service opportunities for our folks and very, very active in social activities. This is something that we began as a transportation organization, and we've really grown into an organization with a lot of opportunities for linkage socially. So, we've all been forced to be creative. Despite the pandemic, we've been seeing some really, really good things happening. Since we haven't been able to have our folks come in, we've been going out to them. And this is it's been an adjustment for all of us, but it's been tremendous. The benefit that we've had by being able to go to people's homes, sit with them, talk with them, see where they live, see their surroundings. It's just been amazing, absolutely amazing for us. And so in addition to the regular calls and visits that we make, we've really effectively taken our in-house computer program on the road. And we launched the Connections Through Technology program, again, with the support of the foundation and the SOM Foundation. And we've broadened our reach to include folks that may not want to come into the center, but they want to participate in an activity or have a social interaction from home. And so essentially we go to their homes, we install a tablet and a keyboard, we train them on how to use it. We put on their homepages linkage to their church or the YMCA or Silver Sneakers or the library, whatever they want, so they can get in quickly. The key that we found is just making sure that there is minimal frustration. So we're there, we're a hotline, and we do repeat visits to make sure that they're comfortable. I think that email has been a huge benefit for these folks in terms of communicating with their families, grandchildren, and the like. So many of these folks have said, my family has tried to do this, and they said I can't do it. And sometimes your family isn't the best ones to do it. They can feel silly in front of us and not be embarrassed, and we love it. We have a lot of success stories, but one of my favorite is our one technology new member she's 93. She has been regular member in our bingo. We call it Zingo since it's Zoom. Zingo, our PSC chat program. She's there every week and it's been wonderful. We've had a lot of fun with her, and we're especially having fun now that she's discovered YouTube. So we are always excited to find out what new things she's developed through YouTube. So again, I guess this has just helped us take a talent and a skill that we had before and look at it in a completely different way. And I believe that this will continue through the pandemic and on after, and help us broaden the group. One challenge that we have, I guess it's in reaching the families of the folks who would be our audience. Since we mentioned that technology is often limited, for the people that we're trying to reach, we've been trying to reach out to families and let them know, you don't need to take 2 hours off of work to take your mom to the dentist, or you don't need to take them grocery shopping. We can do it safely. And what they get from that is independence, self-sufficiency, and they just get social activity. Sitting in the van with folks going grocery shopping, there's a lot of fun conversations because I love doing the ride-alongs. I mean, they're wonderful. So we need to build the family's trust. So we're here for them and make sure that they understand this is here, this is available. And I'm always amazed at how many people, just don't know that this exists. Kind of an aha moment for me, or one thing that surprised me was how much our seniors, how much they themselves want to give back, how much they want service or opportunities themselves. Instead of being taken care of, they want to give back. And think about it. They want to stay active, they want to stay relevant, and they have time. So, for example, half of our volunteer drivers are seniors. Early in the pandemic, we had a number of them delivering groceries. We had them doing visits. They had them, shopping, delivering meals. Our Needlers group, it's a craft group. They knit caps and blankets and make all sorts of things. They deliver those to local hospitals and organizations in Mexico. Many of our folks belong to social organizations, they're churches, but they want more, a larger scope of volunteer opportunities. So that's one of the things that I was surprised that was a real need and something we're trying to respond to. So we appreciate very, very much the support of the San Diego Senior Community Foundation. It has just been a wonderful opportunity for us. Appreciate the opportunity to talk to you, let you know about us, what we do, and how much we enjoy serving this very special, precious population. Thank you.
Thanks, Lisa. Yeah, you listen to her, you could see there's some innovation that she's trying to put in place in this pandemic. I know Derek Quackenbush is somewhere out there on this, he's the chair of the grants committee, and that's what we talked about when we first started out, is what are some of the new innovative programs that we can support that would really make a difference in the individual seniors' lives throughout San Diego. And these grants, we figure are going to hit at least 2,200, maybe 2,500 seniors on a personal basis. So, which is really, really important this time. Next, we're going to have Naja Ibrahim. She's the Director of Health and Wellness at the Somali Family Services. I think the biggest, she has a nice big biography of everything she's done, but she went to UCSD. Yay, that's where I graduated from in biology, and got a master's in health promotion and behavioral science from San Diego State University. So she runs the programs up there. She wrote the grant, and now she's implementing. So you want to tell us about what you're doing? in the area that you're doing it, up in, I think it's City Heights, right?
Yes. Hello, everyone. Good morning. Thank you for inviting me to share a little bit about our program. We're so excited to be able to provide a lot of these services to the seniors. So just to kind of give you guys a little background about our seniors, I'm a little biased because they're my favorite group within all the people that we're serving. The seniors in our community, we work primarily with the refugee, immigrant, other underserved communities out in City Heights, as well as El Cajon City. Some of the languages that we serve are, language groups that we serve, our cultural groups are Arabic speaking, Somali speaking, and Swahili speaking. So we have a pretty diverse senior population that we're working with. And the seniors that in these communities are highly revered. They're very special to the community. In fact, culturally, many people look forward to this stage of life of becoming a senior because you have everyone's respect. You're part of all the decision making in every facet of the society and the community. They're considered the leaders, the elders that really are the decision makers for the community. So the seniors are quite special, and I think it's really important for us to make sure that they stay healthy and safe, especially considering the COVID-19 pandemic. So with the seniors, the biggest challenge I would say is definitely social isolation. Many of these seniors come from communities where, as I mentioned, they're the central figures, and they're the ones that are really living very vibrant lives, and they're going out and doing all these different things with the rest of their community, and many of them becoming displaced as a result of their things happening in their home country, really lost a lot of those natural social connections that existed. And so they really kind of had to find their way and redefine themselves once they're here. And then now with, COVID-19 pandemic and social distancing and the stay-at-home orders and all of these different things, they're further isolated from, even their close loved ones and their friends, and a lot of the activities they're participating in. The seniors in our community are very active. They're, going to different community events. They're attending some of these adult daycare centers where they're hanging out with their friends. They're learning English, so they're part of these like ESL classes, and a lot of these things have kind of come to a stop as a result of the pandemic that we're in. And then all of that is further exacerbated by many of the challenges they were already facing, such as the financial and the food insecurity of many of the seniors, as well as a lot of the barriers associated with language and culture, as well as the literacy barriers. So, and when I say literacy barriers, it kind of falls into different categories. So just like literacy in terms of language, many of the community members might not be able to read or write in English or even in their native language. Many of the community members lack the health literacy, so it's really hard for a lot of this information to reach them in a very effective way. And then additionally, the technology, the literacy issues related to technology. So a lot of things moving virtual has been a barrier for the community. So we've been really working with the community to co-design a lot of these programs and services and things, what do they really want to see? What is going to be effective for them? And so what we've been able to do is we've been hosting weekly town hall meetings for the seniors so that they can still be connected to each other, as well as a lot of the information related to COVID-19, as well as other things that are going on in the community, as well as, learning and knowing about different resources that exist. And then outside of these weekly town hall meetings where they're getting the information and the resources, our community health workers have been providing a lot of safe home visits, and helping them fill out applications to different things that they need. So for example, CalFresh has been really helpful in addressing some of the food insecurity. Many of the seniors that we work with have limited incomes. They mainly have the Social Security income, and that barely covers their rent, to the point of many people that I shared earlier. And so if those community health workers aren't interacting with them and helping them fill out all these forms and providing a lot of the support, these seniors would really be facing even more difficulty. So our program has been able to bridge a lot of these gaps and barriers. And we're so thankful to the San Diego Senior Community Foundation for supporting this program.
I've done 1,000 of these and I keep forgetting to unmute. Well, thank you very much. City Heights is a fascinating community with a lot of different needs up there. So it's not easy meeting all the different needs. So we appreciate everything you're doing. So that's it in terms of the three presentations. So I'll turn it over to Shana, who will see what if anybody has any questions, and we can talk a little more about what we're trying to do here.
Thank you, Bob. And thank you again to Ted and to Naja and to Lisa and Mona for sharing your unique experiences. And I think, for me, it's an important reminder that yes, we know there is this epidemic of isolation among older adults, but it doesn't look like one thing, right? It is unique to each individual that each of you is serving, and that we have to be creative and innovative in the solutions that we support, making sure both that they're culturally responsive and also, that the needs of somebody in a rural community different than those living in more urban communities. And for those people who are already experiencing other chronic conditions, those needs might be different. And so I appreciate really the insights you've all shared. So we are going to move into our Q&A portion of the program. We received a few questions before via email, which I will share. And if you have any questions, you can share them in the chat or use the hand raise function, and we will go ahead and call on you. One of the questions we received, and I think this one is for Ted, somebody asked, they said, as a certified health coach specializing in living with chronic pain, I would like to know how long-term isolation impacts seniors living with chronic conditions.
Yeah, so the great question. In terms of studies looking at specifically at chronic pain, I don't know many. However, in terms of chronic conditions, it's very clear that social isolation and loneliness increases the risk for exacerbations of those chronic conditions like heart disease or other comorbidities, and in particular, mental health. There are much higher rates of anxiety and stress and depression for seniors or anyone actually who rates higher in the scale for loneliness or social isolation. And then even on a neurologic basis, dementia rates are worse or increased amongst seniors that are more socially isolated and lonely. So there's no doubt if you exacerbate chronic conditions like that, pain management is going to be more challenging if the question was specific to chronic pain. But in general, chronic conditions, there's a much higher rates and exacerbations and worsening of those conditions.
Thanks, Ted. So this one I think is for our providers. So the question is, it says, I know the Seniors Foundation recently launched a senior center coalition. How have you collaborated with other senior center providers and leaned on and learned from these other providers during the pandemic? So I don't know, Lisa or Mona or Naja, do you want to share how you're learning from your fellow providers?
Well, I'll take a shot at it. The foundation really has provided linkage, with like-minded organizations, and I am a huge proponent of you can't be all things to all people, and I've been known to steal shamelessly from time to time. But I think the collaboration and understanding what other people are doing, not reinventing the wheel. People that I have been working with, and I've had such great exposure to other organizations through this collaboration, very, very happy to share what they've done. I'm happy to piggyback off another idea. It's also for us, it's given us exposure to all of you. I mean, people that didn't know about us. And I think the fact that we all can work so well together and leverage off each other is a huge opportunity from the standpoint of, donation support, being spread and, very, very widely and be effective. So, I mean, to me, it's been a great opportunity to learn about ways that I can be better prepared to help our community, and also share our success stories as well.
Thanks, Lisa. And I guess I should add, for those of you that don't know about the Senior Center Coalition, this is something that the Seniors Foundation launched. And so while Bob said we don't provide direct programs, this is an area where we do bring providers together to share best practices and provide opportunities for collaboration, really to drive impact across the community. So we received an email from someone who says, I'm ready to get involved financially and in a volunteer capacity. What is my first step? I can tell you financially, as Bob mentioned, supporting our No Senior Alone campaign and really leveraging this match by the Somali Family Foundation is a great way to get involved. So again, every gift will be doubled. And as you heard, the dollars come in and we are putting them out into the community so that providers can do all of the great work that they do. In terms of volunteering, I'm wondering, Mona or Naja or Lisa, do you need volunteers? Or any other providers out there that are on this Zoom, if you want to put in the chat, if you need volunteers,
Meals on Wheels.
People that are looking.
So Shana, for us, we actually have our internal seniors that volunteer. So we would have to say for Neighborhood House Association, for the senior center programs, we are not seeing the need for volunteers. We have quite a few of our even internal staff who does the home deliveries and things like that, and it's working out well. But we appreciate once it opens, I think that's when we really need our volunteers. That's always been our need. When the center is open, we've had the worst luck in having consistent volunteers because we do need folks to help with seniors getting to their bus or trolley or the ride, or to come into the center, or to go use the restroom, or to help set up their meals. So when we do open up, I will say it's going to be a pretty big need for us, which is volunteers.
Thank you. And I do see, so Meals on Wheels, this is in the chat, always needs volunteers, and you can go to their website to learn more. So if you want to make sure that seniors get the food they need, this is a great way to do it. And Lisa or Naja, any volunteer needs for either of you at this point?
I would agree with Mona. The volunteer needs are really great, once you're open, and other than driving, that's really all we would need. I would say though that, when we do open, continuing the porch visits for folks that don't want to come in is a wonderful way for our volunteers to give back and participate.
Fantastic. Okay. We also have a question about social isolation and homelessness. So the question is, I've heard social isolation is contributing to homelessness in seniors, and that more and more seniors are facing homelessness in San Diego. What are all of you seeing? Bob, do you want to talk a little bit about homelessness in seniors?
Yeah, just a quick some numbers. The latest count in San Diego, about 27% of the homeless population is over the age of 55. It's now the fastest growing population of homeless people, and it's going to continue to rise. One of the issues with isolated seniors is their easy prey. We had a conversation with the district, district attorney, and he confirmed that they're seeing a huge increase in scams on isolated seniors. And another big thing that's happening is they're finding that when an apartment house is being converted. They're going to increase the rents and all of this good stuff, and they're going to evict everybody in the place. They go after the isolated seniors first because they're the ones that don't put up a good fight. And so they can go after them, get them out, and then they go after the younger people. It's really something. An activist in Chula Vista told us about this, and turns out we checked it out with the district attorney. He said it's true. These things are happening all over San Diego County. When they find an isolated senior, they take great advantage of it. I heard a story the other day with the FBI. A lady, of course, she responded to some scam and took $50,000 out of her bank account. The FBI contacted her while they were in her house going through that case. The phone rang, she picked it up, and she started getting sucked in again to the next scam. And the FBI was sitting there saying, we just can't believe, this is what's going on. They just target these people. And they didn't know what to do to help her to stop. They educated her, they gave her, lots of counseling, but she still was ready to get sucked in again. So isolated seniors, they just don't understand all the services that they're available out there. Our motto is we want to ensure that every senior has somebody they can turn to and trust, which means when a senior gets a call like that, or they get a rent increase that's ridiculous, they can pick up the phone, and what we believe they can pick up the phone and talk to a local community senior center, and they can trust that person to be able to give them the right information about how to deal with that situation. Whether it's the neighborhood, house, Somali Center, every senior needs to know that there's somebody there they can trust. They can pick up the phone and get connected and get help. So homelessness is becoming a bigger issue. Again, people are on a fixed income, their rents are going up, and and this is another call we got. The guy, he was a janitor for the city of San Diego for 20 some odd years. His pension is, set basically. And he got this giant rent increase. He had 30 days notice to get out, which means he had to get to move to another place. He had to get his first month's rent, last month's rent, and a security deposit. And he did not have the cash to be able to do that, to find another place. And he was literally just days away from being homeless. So we were able to connect him with forget the name of the organization, but they were able to help him. So it's a big issue.
Yeah.
It's with the growth of seniors, it's going to be a bigger and bigger issue.
That's right. And, I think, it's a population we just don't hear about when we think about homelessness, and important, at least for all of us, to be able to raise awareness and let people know that this represents nearly a third of the local homeless population. And often this is a population that doesn't have a voice, that isn't out there advocating for themselves. And so our goal is to advocate on their behalf.
Right. And the seniors they're not drug addicts. They're not, alcohol abusers. So if you can get them settled into a stable environment, they're not going to go back into the streets again. So it's an easier problem to solve in terms of helping seniors.
Right. Thank you. And I am looking, so I don't see any more questions. So I think we will go ahead and wrap up. I want to thank everybody who shared questions in advance. Thank our panelists for all of the insight you've shared with us today. And I want to thank all of our supporters. We are grateful, so grateful for all of our generous No Senior Alone campaign funders. I do specifically want to recognize, and I know Bob already did, the Gary and Mary West Foundation, who I know is joining us today. They've been tremendous supporters of ours, but really leading this effort to address the needs of older adults. So thank you to them. Together with our supporters, as Bob shared, we've already granted out more than $200,000 to support isolated local seniors in the last few months. We've just kicked off a special program to provide material help and hope during the holidays. And as you've learned, older adults across San Diego are experiencing this epidemic of isolation, which is taking a toll on their physical and mental health. And through our campaign, you can make a difference by supporting impactful services services that are provided in person in a safe and socially distanced setting, online programming, and phone-based services, all of which you heard about from our providers today. And all of these things we know will measurably improve the lives of local seniors. And again, the great news is that anything you give will be matched by the Som Family Foundation up to $500,000. You can learn more about the campaign at www.sdscf.org/no senior alone, or you can reach out to me if you'd like to learn more. I will also share that we're going to have some of our work and the issue of social isolation featured on CBS 8 this week. So tune in this evening if you have a chance. And if not, have a wonderful rest of your week. Happy holidays. And we look forward to seeing and working with all of you. Thank you so much for joining us.
Thank you.
Thank you.
Thank you, Shana.
Of
Thanks,
course.
Bob.
See ya. Thank you.
Nice to see everyone.
You
Thank you,
all.
Bob. Thank you, Ted. Thank you, Shana.
Bye.
Bye.